All right. Hi, everyone. Thank you so much for joining us today for our Facebook Live event, Mouths in Medicare. It is time for Congress to act. And today I am joined by a wonderful panel to really emphasize why adding a dental benefit to Medicare is so important, why it is a health equity issue, why it is a health issue, and why it matters to so many people across the country, and that Congress really needs to be taking action. Luckily, Congress is considering it, but now is the time for them to really move forward. For far too long, our health has depended on our wealth, and dental care is so expensive that without insurance, it is the #1 medical service that people in America skip to cost. It's time to change that by ensuring families have access to affordable oral health care they need and they deserve. Strengthening Medicare by including dental coverage would represent a giant step towards improving health equity, and financial security for the nearly 60 million older adults and people with disabilities who rely on the program for health insurance. So to kind of elaborate on this need and why this issue is just so important and why it is so critical that Congress move forward on the proposals in front of them, I have a fabulous panel with me here today, and I'm going to have each of them introduce themselves a bit and their story here in a minute. But in brief introduction, I'm joined today by Paul Gibbs, who is an independent filmmaker, healthcare activist, and kidney transplant recipient who has experienced Medicare dental shortfalls firsthand. And I'm also joined by Dr. Richard Rodriguez, who's a dentist and advocate who has seen many of these issues firsthand, and Dr. Tony Black, who is also a dentist and advocate and has seen many of these issues firsthand. So to start, I'm going to turn it over to Paul, and he will introduce himself and share his story. Thank you so much for being with us today, Paul.
Thank you so much, Melissa. I'm always very honored to be working with Families USA and participating in any way with these important subjects. So to talk a little bit about my experience, I start by going back to 2009, when I was working part-time and also working freelance as an independent filmmaker and actor and various things, which didn't offer me healthcare coverage. And I found out that I needed a kidney transplant sooner rather than later. I'd been born with kidney problems. I'd had them all my life, but it was very sudden that I needed a transplant. And as I said, I had no healthcare coverage. Now, fortunately, Medicaid was available and Medicare was available to me because we do have Medicare coverage for younger people if you are in end-stage kidney failure. As I was getting ready for the kidney transplant, the doctors had me go through a complete workup of every system in my body, the heart, lungs, everything, to make sure that nothing else was going to be a danger to the new kidney. And part of that was a dental exam. The dentist gave me an okay to get the transplant. And by the way, that dental exam was not covered by Medicare, the only part of the workup that was not covered by Medicare. So I managed to scrape up enough with the help of friends to pay for that. But as I said, the dentist gave me the okay to get the transplant, but he said I did have cavities and some other issues that needed to be taken care of. They could be dangerous to the kidney in time, but I didn't have the money to take care of them at the time, so I went ahead with the surgery. And then 5 years later, I was doing great with the new kidney. I had gotten married, and I was going to be having a child within the next year. My wife was going to be having a child. And about that time, as my wife's dental coverage for her job started to kick in, that was when I noticed that my teeth were hurting a lot. In fact, I had some teeth that were starting to fall apart. I was losing teeth. So I went, fortunately, at that point, I had coverage and was able to go to the dentist, but it's been a long, drawn out process. We've kept maxing out our dental coverage and still having to pay a lot out of pocket. I've had, as I said, teeth falling apart. I've lost 3 teeth and still had to pay thousands of dollars in bills, even with the dental coverage. And this is because I was not able to take care of those problems sooner because I didn't have the healthcare coverage for for dental. It speaks volumes to me that the doctors, all the medical people, when I was getting my transplant, saw my dental health as a vital part of my overall health. But my Medicare didn't, my insurance didn't. And that is a major problem in this country. We view dental health as lesser than and separate from overall health. It's not. All the systems in our body work together as part of one miraculous whole, and our healthcare coverage needs to work that way too. We need to integrate dental care into that overall whole so people like me don't go through that. People aren't left with thousands of dollars in medical bills because they can't afford to pay to see a dentist on time. So that's my experience. I know it's the experience of so many other people on Medicare who can't afford to pay those dentist bills. And that's why I think that this issue is so important and needs to be addressed by Congress. And now I'm going to turn things over to Dr. Richard Rodriguez, and he can share some more with us.
Everyone, like Paul said, my name is Dr. Richard Rodriguez, and I'm happy to be speaking here with you all today. And thank you to Families USA for hosting this incredibly important conversation. And I want to give a special thank you to Paul for sharing his personal story, because just in my short time of being a clinician, I've had multiple stories where patients have had difficulties paying for their treatment and having to modify their treatment plans because of their financial limits. And it's not easy to be honest about these issues. And I think a lot about why it's not easy to be honest about these issues. And my conclusion is that it's difficult. And we have a culture where we blame individuals for not being able to afford dental care, rather than looking at the entire system about why it's so expensive and inaccessible in the first place. And whenever I was treating patients, one way that I was able to connect with them and to build a sense of trust was that I would tell them about my personal life, my personal goals, and telling them that I wanted to pursue an education in public health so that I could work on these issues. And almost every instance, they got excited and their eyes lit up because they struggled to talk to me about that. And they knew that they were working with a healthcare provider that was willing to speak up for them and be honest about the ways that the system has failed them. So for Paul to share his story, I think it's a true act of strength. And I want to encourage anyone that's watching out there to do the same. While my experiences with patients were difficult in those moments, I think that they're really powerful in that they inspired me to be here to study for my master's of public health. And I want to be a leader on these issues for the sake of my patients, but also patients everywhere. When it was announced that the Build Back Better agenda would include extending care to our patients and our elderly through Medicare, I knew that this was going to be a crucial moment for the profession and our patients. So to any dentist that may be watching this, I want you to critically think about what this could mean for your communities. And for me personally, I kind of think back to my hometown of Odessa, Texas, and I think to my grandparents. And God bless them, they're doing well. But I know that their oral health is not in the best condition. And I kind of think back, how better would it be now if they had dental coverage on their Medicare and they visit the dentist as needed, right? But I want them to be able to access the dental coverage or the dental care that they need on a regular basis so that we don't get to these points where they're needing care at a crucial point where they would have been benefited if they had more preventative care. And we can kind of look back at our hypothetical scenarios in the past, but we have power to change the future. And I want to look towards the future, and not only for my parents, but also ourselves and our community members about having these discussions about, I wasn't able to go to the dentist because of this coverage, or because if the plan and the policies don't reflect that. And so I want to look forward, and I want to work together with policymakers, with dentists, and with patients and advocates on including this and making sure that we all make the right choice and encourage Congress to make the right choice. And now I will pass it over to Dr. Black, and he'll talk a little bit more about his experience.
Thanks, Dr. Rodriguez. I'd like to echo you in thanking Paul for sharing his story, and also for thanking Families USA for hosting this event, which I'm extremely happy to be part of. I'm a general dentist. I've been practicing in the Northern Virginia area in the Washington, D.C. suburbs for about 20 years. And I've always been saddened by older patients who, forgo treatment. They put off treatment because of cost. And many of these patients will have comorbid conditions like diabetes or kidney disease, like Paul, cardiovascular disease. And since they can't afford treatment, most of the time they just put it off and they just hope that things won't hurt or their face won't swell. But inevitably, those things happen. And when they come in, they can't afford, to have things fixed properly. So they have the tooth removed. Or in the case of gum disease, which is much like high blood pressure in that it doesn't hurt. They just live with that forever. They just don't treat it. And what this does is, it can eventually lead to tooth loss, but it also compounds the severity of their systemic issues. And so, they're just having that drain their system their entire lives, and it's never addressed properly. And so, dental care is expensive, and a lot of disabled Americans and a lot of senior Americans can't afford it, but it's what they need to be healthy. And that's why I support adding a dental benefit to Medicare. So I'm going to hand it back to Melissa.
Thank you so much. I so value all of your perspectives on this issue, and it's so important that people hear from you all who are, able to see how this is all playing out firsthand, and you're experiencing how it's playing out firsthand. So thank you for sharing your stories. Now we're going to transition into a brief discussion, kind of expand on some of these things a little bit more. So I'll start with some questions. Paul, to start, can you expand a little bit on how your experience would have been different if you had been able to address the problems with your teeth right away and didn't have to delay care? I know you talked about this a bit, but it would be wonderful to hear a little bit more.
Well, if I had been able to get right to taking care of teeth, I would have, first of all, I would have done so rather early. And at that point, the big difference, I think, the easiest way to sum it up is I'd still have all my teeth. I wouldn't have lost any. I wouldn't have gone through these difficult, sometimes painful experiences. One tooth had to be extracted, and in the process, some bone was pulled out with it, and that was just unbelievably painful. And I wouldn't have had to go through that. It would have saved me and my wife so much stress and so much money. Just a couple of months ago, I had to have 2 root canals, and even with the last part of it, about $200 worth being paid for by what was left of our insurance for the year, it still cost $1,400 out of pocket to get those 2 root canals. These are very expensive procedures, and that's money that we could have used to take care of our children for all sorts of things. And yet my experience would be much different. I would probably have better overall health, and I certainly would have better dental health. I'd have all my teeth if I had been able to take care of this in a timely manner.
Thank you, Paul. I appreciate you sharing. For everyone, this Medicare dental coverage has been widely supported across the country. There's been poll after poll after poll showing the overwhelming majority of Americans believe that dental should be added to Medicare, but it still hasn't been done. So what would it mean to each of you or to some of your patients if Congress could get this done now?
For me, it would simply mean that other people wouldn't have to go through what I did, and that is so important. That's why I got into healthcare activism, was to prevent other people from having to go through the experiences I have. And these are people, these on Medicare, largely there are parents and grandparents and people that we care greatly about, but often don't think about in some of these issues. And it's so important that there are also younger people who are on Medicare for reasons like end-stage kidney failure. And so many people wouldn't have to go through these experiences.
Yeah, I agree, Paul. I mean, as we age, or if we have health challenges that lead to a disability, like kidney, failure, we become more vulnerable to disease, whether it's dental or systemic. While dental treatment can obviously help achieve better oral health, it also contributes to overall health, like you were talking about. So adding a dental benefit to Medicare will help millions of Americans who are suffering not only with mouth pain, and are having a hard time eating and they're embarrassed to smile. It will make them healthier overall. And it'll help them fight the diseases that they suffer from the most, like kidney disease and diabetes and heart disease and stroke. So the list goes on. So there's endless benefits. So it would be tremendous to have the benefit added to Medicare.
I'd like to add to that. I'm a bit of a history nerd, and I kind of have read a little bit about the history of when Medicare was being created. Now, there was this exact same debate happening about whether or not to include dental coverage within the Medicare plans. And there was a lot of pushback from the profession on every side of the profession. And now there's less pushback, but there's definitely debate still happening. And I think this would be an opportunity for the profession to kind of make right the mistake that they made about 50 years ago whenever Medicare was first created. And not only on the responsibility of the profession, but the responsibility of our government. I think it could instill a sense of trust because, like Melissa said, there is poll after poll that shows that this is what people want. And if their government provides and delivers on that, then I think people would be more willing and have a little bit more hope that their government serves them.
Yeah, definitely. And that's something that, when Medicare was created, its promise was to support the health and financial security of older adults and people with disabilities. And without oral health as part of that, it really cannot deliver on that promise in a way that treats people as whole human beings, or removes the worry from those of us that are taking care of older parents and grandparents or family members with disabilities. So I certainly resonate with that. And to that end, Dr. Black and Dr. Rodriguez, could you elaborate a bit on why oral health care is so particularly important for older adults and people with disabilities? What are some of the things that are likely to come up in a course of treatment for these people?
Well, I can share some patient experiences that I've had. Some patients that really stand out in my mind. I had a woman, an older woman who was on Medicare, and she actually sold her car to help with her dental finances. And she had to have all of her lower teeth removed and have a denture put on, some implants, which is very expensive. And then she had all of her upper teeth crowned. And, she got through that, with the help of the money from her car, but then she ran out of money and she quit coming into the office. And so she eventually came back a couple years later, and she had a whole bunch of new decay around the work that we had done on the top teeth, and she couldn't afford to fix it. So she started having those teeth taken out one by one as they would start to hurt. And so she had spent all this money in the past, and now it's all going to waste because she just couldn't afford to have the work done, or have more work done. She reached a limit that she just couldn't get past. And that's the problem with a lot of these people, is they have a fixed amount of money that they can put towards dental care, and they can't go past that. So it's a hard stop for them. And so even when older people or people with disabilities try, sometimes they fail because they simply can't keep up with the cost of the dental care.
Absolutely. Thank you, Dr. Black, for sharing. And I have similar stories, and I've only seen patients for 2 years. And so I can't imagine how much more experience you have than I do. But I would also like to emphasize that, especially with patients that have conditions or take medications that lead to dry mouth, can complicate their treatment. And a lot of our patients don't understand that. And especially with referring to denture treatment, as you may or may not know, people kind of assume that dentures are a replacement for teeth. And you have to adjust your patient's expectations. They are a substitute. They do not, nor will you ever have that same experience of having teeth inside your mouth like you have now. And whenever you complicate that and you're taking medications that also affect the saliva in your mouth, the saliva is fantastic for fighting cavities, but also the saliva is great for helping your denture fit inside your mouth and having it create more stability for the use of your denture. So if you have other systemic issues, if you take anti-anxiety, antidepressive medications, then your chances of having a decent denture dramatically lower. And I think that's something that's also really important to consider.
Absolutely. And one last question I have for all of you is that oral health is a real health equity issue. And we know that for, Black older adults, the percentage of individuals with complete tooth loss is almost double the national average. We know that, there is a huge disparity in the percentage of Hispanic American older adults who have untreated tooth decay compared to white older adults. We also see these similar sorts of disparities in terms of who has seen a dentist in the last year. Black and Hispanic older Americans have not seen a dentist in the last year more often than their white counterparts. So, and certainly we see a lot of these disparities showing up in terms of, older adults with higher incomes and rural seniors having much less access than older adults in urban areas. So could each of you speak a little bit to how dental coverage is an equity issue?
I can.
Sorry, go ahead, Dr.
Okay, I'll go ahead. I kind of think back to my family, Latino family in West Texas, and I think about specifically my mother's parents, which are my grandparents, and they speak mostly Spanish, and they knew just from their limited time from living in Texas before immigrating from Mexico, they knew how important it was to have oral health. And they were not the most rich family. They were maybe middle class, lower income. And they invested into my mother's braces and the dental care of my aunts as well, because they knew that with good teeth, you were able to, have higher chances of reaching across socioeconomic levels and circles. And I think they made some really difficult choices because they knew that they were already held back in a certain way because of their race and their language barriers. And so by providing care to our elderly, I think that will kind of have this trickle down effect where there's just a general sense of appreciation for oral health. And I think as we see poll after poll, there is an appreciation for how important oral health is. But you can acknowledge that something's really important. But if you don't have policy to support you and to give you that access to care, then you're kind of just there with your hands tied. And I think this is a great way to alleviate some of those disparities that we see.
Yeah, I agree. Policy has to be in place because it's at the root of everything. And so, Melissa gave some pretty startling statistics, I think. 31% of older Black adults have lost all of their teeth, and they have no teeth. And so that's almost double the national average. And then, 7 out of 10, I'm looking at a statistic here of Black Medicare beneficiaries, and 6 out of 10 Hispanic beneficiaries didn't see the dentist in the last year compared to 4 out of 10 white beneficiaries. And, it's not just a racial divide, it's an economic divide too. I don't want to make it all about that. If you think about, dental care, if you have dental insurance and the copays are still really tremendous, imagine having to bear the full cost and you have an income of, say, $20,000 a year, and you have treatment you need just to fix, say, one tooth, a root canal and a crown. It's almost $3,000. Your monthly income is less than $2,000. It's just simple math. So it's an economics, an income divide. It's a racial divide. As Dr. Rodriguez spoke to, it's a cultural divide. So policy is at the root of this, and it can help make things whole.
And, I just want to add that something that has really been reinforced to me through the pandemic is how there is also a divide between the healthy and those of us who live with chronic illnesses or whatever. And I can absolutely tell you that I do not feel like an equal member of society right now as a chronically ill person. And if you don't have that access to healthcare to stay healthy, you're not an equal member of society. And when you're looking at people who are already in marginalized populations, then that creates marginalization on top of marginalization. And there are so many reasons why dental care contributes to that, from as I think it was Dr. Black who mentioned being embarrassed to smile, or being in pain all the time. These things are very real issues, very real problems. People fight through that dental pain all the time. I've done it all the time, but it really affects your ability to do much of anything and to participate fully in life. And so we're pushing people further into the background. People, older people who are already often not focused on by society, marginalized minority populations, we are adding to inequality by adding this healthcare inequality on top of it. And everyone should have equal access to healthcare. It should be based on need, not wealth or influence. And as I said, if you don't have equal access to healthcare, you're not an equal member of society.
Absolutely. Thank you so much. This has been a fabulous discussion. And to wrap us up, I want to thank all of you again for joining us. I want most especially the panelists, but also you all who are watching today. And I want to reinforce the fact that this is an issue. Medicare dental coverage is being considered by Congress right now. So if you are someone who is willing to step up and take action, now is the time to really weigh in on Medicare dental coverage. You can, contact your member of Congress directly. You can talk about this with your family and your friends and your neighbors. If you have a personal story to share, please, Families USA has a Share Your Story page. We'd love to hear from you. There are a lot of different ways to get involved, and we want to help you raise your voice in support of this critical issue. So with that, I'm going to thank our panelists one last time, and we look forward to being in this fight with you all. Thank you all for joining us today.
Thank you.
Thank you.